Hi, this is Sam Hoops, and this is Casey McNerney's Level 1 Reformer Certification.
All right, so I am Casey. I'm going to be your Pilates instructor today. Before we get started, is there any injuries, any pain you're having, any recent surgeries?
No recent surgeries, but my lower back does bother me.
Okay.
So, it's okay right now, but
Okay.
normally it does bother me.
Okay. Any injuries in the past or
Just the breast cancer, but that was 6 years ago.
6 years ago? Okay.
It's been a while.
Okay. And how do you feel like your mobility is in your shoulders?
Good.
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 All right. And what do you do for a living?
I'm a mom.
Mom. Okay.
Mm-hmm.
All right. What do you like to do for fun?
Pilates.
Pilates. Good. Okay. All right. Anything else I should know about before we get started?
No, I think that's it.
Okay.
Yeah.
All right.
Okay.
Good. All right. So we're just going to take a look at your posture first. I'm going to have you scoot up a tiny bit more towards the mirror. A little too far, sorry. Okay, that looks. Might be in the way of the camera.
Yeah, thank you.
Okay.
Oh, yeah.
Okay.
Yeah, you might want to stand over to the left just a
Okay.
little bit. Thank you.
Yep. All right, so looking at her ankles, she's probably slightly plantar flexed. And then, you hit down here. And neutrally, and the knee joint is fairly neutral.
So you use more anatomical language.
So
Like
she's
where
not.
you're palpating.
Okay,
Yeah.
so a greater trochanter and the lateral
Thank
malleolus,
you.
and I'm using, drawing a plumb line there,
Thank you.
helping the ASIS and the PSIS. And then finding the midpoint of that compared to the greater trochanter. Sorry.
You okay?
So she's probably slightly flexed in the hips, too close to neutral.
So you're going to call it neutral or flexed?
I'm gonna call it flexed.
Okay.
And the ASIS to PSIS, she's anteriorly rotated. Okay, and then we're looking.
So what was the,
So the ASIS
She has
is
a-
lower, an anterior rotated pelvis.
okay, so. it's-
Anterior tilted,
Okay.
is that what you?
Mhm,
Yep,
Thank
okay.
you.
And then we're looking at the lumbar spine. She's a little bit more lordosis than normal. Coming up to the thoracic spine, she's a little bit more kyphotic than normal.
Is that lower thoracic?
Yeah. Lower thoracic, she's kyphotic. Upper thoracic, more on the flat side.
Okay.
Cervical. She's not. Mine's not quite.
Did I move?
No, you're okay. I mean, aside from the plumb line, she's got a forward head compared to the shoulder. And then I would say her cervical spine is pretty neutral. Right, and then
Okay, Casey, just do one thing for me before we move on. Can you tell me what body part, tell me about the plumb line?
Yep.
Describe it.
Yep. So at the ankle, the plumb line should be slightly anterior to the lateral malleolus, slightly anterior to the knee joint, going right through the greater trochanter, pretty much bisecting the midsection through the shoulder joint, which we're a little off here, and then through the auditory meatus.
Okay. Are there body parts that are deviating from the plumb line?
There are, mainly the body, so the shoulders.
We'll start at the ankle.
Okay, yeah, so don't choose, so slightly plantar flexed,
Okay.
so she's,
Hmm?
the knee looks fairly close to neutral, but maybe slightly, a little bit more anterior. And then pretty straight through the hip joint. She's definitely, her midsection is, at least the lower midsection is anterior to the plumb line. Upper back is posterior to the plumb line. And then head is in relation to the back being kind of posterior to the plumb line. She has a forward head, but it's actually kind of in line with the plumb line right now.
Okay, thank you.
Yep. Okay, and then if you could face me and have the plumb lines right in between your feet. Okay. Perfect. Huh. Looks like.
Yeah, it looks like.
Oh, me? On the back? Do you want me?
Do the.
Oh, both sides?
Yeah,
Oh,
do
okay.
the other end, the other side.
You face, that way.
This way, I'm sorry.
No,
Don't
that's
be
good,
sorry.
it's my fault. Scoot just a tad bit forward. Right there is pretty good. Perfect, okay. So again, slightly plantar flexed at the ankle. And again, palpating the greater trochanter and the lateral malleolus and drawing that plumb line. That's pretty much right on the knee joint. Plumb line here is slightly anterior to the knee joint though, so you could say she's slightly hyperextended there. And then going to the PSIS and ASIS. Again, she has a anterior tilt.
Would you call that neutral, or is that an anterior tilt of her pelvis?
I would call that
An anterior tilt, okay.
Yeah.
I agree.
And then midpoint compared to the greater trochanter. Still just slightly flexed. And then midsection again, lower, the abdominal area is anterior to the plumb line. Thoracic region is posterior to the plumb line. Still has the lordosis, lower thoracic kyphosis, flat back, or flat upper thoracic, and forward head.
Okay, thank you.
Okay, yep. Go ahead and face me, feet right in the center, or the plumb line in the center of your feet. Yep. Okay.
Take your glasses.
I'm sorry.
You're fine.
Okay. Should I move
Think
it?
a
I
tiny
say it's
bit
still
to your-
moving.
Tiny bit to your left there. Okay. So she's just a little bit more pronated on her left foot compared to the right, but they're both. I'm sorry, no, she's, let's see, more supinated actually on the left. Yeah, more supinated on the left. I don't know why I was saying pronation first. Left, no, or the right's fairly neutral. Knees. Not necessarily not knee or bow-legged, but already I can see some medial rotation at the hips, which we will look at later. ASIS looks to be pretty level. Iliac crust level. And then from the ASIS to the ribs, sorry.
Okay.
Oops, sorry. No, looks to be fine there, no side bending or any lateral deviation of the ribs. And then we look at the sternum for any trunk rotation. Looks pretty good. And you can also maybe see it from the ASIS here. This right ASIS may be more anterior. We'll look at that from the back, but I think she has a little bit of a rotation towards the left.
Would you call that a clockwise or counterclockwise?
Counterclockwise
Okay.
rotation. And then sternum and then shoulders, and our collarbones or the clavicle out to the acromion process. She's a little bit elevated on the left side, slightly compared to the right. And the waist looks like we're deviating a little bit to the left. So head on top of shoulders, slightly, maybe some left side bending, and maybe a little bit of right orientation. Okay. And then we'll go from
Okay, hold on.
there. So
What are you calling her head?
head left laterally flexed, or
Tilted to the
Tilted.
left? Okay.
to the left, yeah.
And then also, was there anything else on the head or just?
Very slight right rotation. Oh, laterally flexed right with just a tiny
Okay, so would you call that a counter or
clockwise.
Okay, thank you.
Okay, and then we'll flip around and face the door for me, please. So a little bit, tiny bit more convexity into your, so medially. Meaning she would be in a slightly pronated position. I'm gonna have you just scoot tiny bit to your right side. Good, perfect. Okay, and then,
So were the calling the ankles?
what's that?
What were you talking about with the ankles?
Well,
So we're confirming from the front.
confirming from the front, okay.
Yeah, so what-
So she's more, I'm not going by the calcaneal convexity, she is slightly more supinated on the left side, and I'm gonna call the right neutral.
Perfect. Thank you.
Yep. And then palpating the femoral condyles, and to confirm she is medially rotated at the hips.
Femurs.
What's that?
Femurs.
Well, yeah.
Yeah, I know.
And then both PSISs, checking to see if they're level. Looks good. Palpating the iliac crest. Again, looks good.
Is there one more thing about the pelvis? Confirming one more thing from the front.
From the rotation?
Yeah.
Okay. So yeah, I'm gonna confirm that it is a counterclockwise rotation.
Okay.
And then we're feeling the inferior angles. It looks like she is a little bit upwardly rotated here.
Is that upwardly rotated in both?
On both, yeah.
Thank you.
The left feels slightly elevated compared to the right. Can I see 3 of your fingers together, please? And measure how much. So protracted on the right. And protracted on the left. More so than the right. Outward rotation, protraction, elevation, and from the medial border. No excessive winging. She's tiny. Tiny bit, not bad. Not bad. And then we would check the electron process, and she is medially rotated on the right. Not as much, but medially rotated on the left slightly. And then,
Sorry, there was just one more in scapula.
The scapular position?
Yeah.
Oh, anterior tilted or posterior tilted? She would be anterior tilted. So the inferior angle
So is it,
reaching off.
would it be tipped or neutral or?
I would say she's slightly anterior tipped on.
Okay. Both?
Yeah.
Thank you.
Mm-hmm.
Sweet.
Everything.
Okay, thank you.
Okay. You're welcome. Thank you. All right. That's it for the, no, one more thing is bending forward, right? Okay, go ahead and bend all the way, reach and play your toes. And then back up. So she's got a little bit more of a hump on the left side. Could be that thoracic, or the rotation she has. Go ahead, one more time for me. And she's got a little pitch going to the right. And she goes down and back up. Good, okay.
So she
So now,
definitely has some imbalances,
yes,
right?
not
Okay.
perfect there, yep.
You found imbalances in where?
So she has excessive muscle mass on the left side, so this could be slightly rotated, counterclockwise, and then also in the spinal articulation, she's got a little hitch.
Like a,
Yeah, kind of goes off to the right, going down. And then,
so, Marty, will you face the mirror? Thanks.
doing this side again. Oh, okay.
Thank you.
Yeah. And then bending down again. Back up and back up, so the lumbar spine is a little bit on the flatter side. One more time for me. Starting at the head, yep, getting down. Good, so you can work on a little bit of lumbar flexion there.
Okay, so lumbar flat.
Yeah.
Okay, so what are we gonna do with Marnie?
All right, so speaking of the lumbar lordosis, we'll work going into a little bit more imprint, engaging the obliques underneath the abdominals. With the anteriorly tilted pelvis, we'll work on some glute muscles as well as stretching out the hip flexors. In the thoracic area, I want to work on more spinal articulation and getting her into thoracic extension. At the knees, with just slight hyperextension on the right side, I think work on some hamstring strength and head positioning. She may need a prop underneath or a pad underneath her head and the headrest usually because of that forward head position, but we will be working into some cervical flexion as well. And then lots of scapular stabilization and working on the opening up the chest for those rounded shoulders. Correct external rotation, stretching the pecs. I wasn't counting on how many I've said.
Perfect.
Need more?
No, it's
Okay.
fine. Thank you. Okay, so let's get the mat out here.
Okay.
And if you want your glasses back, you
I'm okay right now.
can. Sure.
Yeah.
Okay.
Yeah,
Keep
I'm gonna
seeing
keep
me.
it. No, I can't. You're all real blurry, but it's okay.
And then we'll just do. Yeah, let me make sure that's good for. I wonder if we should. Let's turn it the other way.
Turn it.
Yeah,
that
so we
probably
can-
makes sense
Yeah, so I can see her body.
for the camera.
Yeah, thank you.
Yep. Okay.
Right, perfect.
So we're gonna go over the 5 basic principles of Pilates. So the first one, we'll start with breathing. So you can go ahead and lie on your back. With our breathing, we want to breathe in through our nose and out through our mouth through pursed lips. Okay, we're gonna be utilizing the lower lobes of the lungs for better gas exchange. So I'm already gonna probably put a pad underneath your head. Go ahead and lift it. Okay. So what I want you to think about is when we breathe in, we're going to be breathing in through our lateral and posterior lobes. So I want you to put your hands on your rib cage, right on the side. Yep. So go ahead and breathe in through your nose. Feel it come in through the sides. Let's go a little bit more out to the side. Good. And out through your mouth. Good. Should feel that breath go into the mat as well. Correct. Breathe into your hands. Good. So this breath also helps with, when we exhale fully, we're also helping engage our abdominals. So go ahead and exhale, keep going, exhale fully, and you'll feel those abdominals kick in right there. Okay, that's helping that transverse abdominis kick in, which is a muscle that wraps all the way around our lower abdominal area from the spine up to the front of the abs. So what that does is kind of like our anatomical girdle, and really important to stabilize the spine, especially in a neutral position. So to work on that transverse abdominis in this position, we kind of already did it, but just exhaling fully, and you can kind of bring your fingers right inside your hip bone here, your ASIS. And when you exhale fully, you should start to feel that deep layer kind of tighten up underneath your fingers. Perfect. So that's what we're going to want to work on once we're on the reformer. Okay. Now in this position, let's do. No, that's. So what we're going to do also is with the breath. I'm going to have you get up again. So we're going to work on activating the pelvic floor, which is, sorry, that's
I know.
and I can't come straight. So what you're going to do is kind of kneel on this ball. So just going to put it underneath your butt there, kind of kneeling on it in between your feet. And, yep. So what I want you to do is think about, so when we engage our pelvic floor, that's also helping to engage our abdominal muscles and that transverse abdominis. So think about just slightly kind of cinching together and lifting, almost like a drawstring bag. So this is the pelvic floor that you're contracting and lifting. So it's a tiny squeeze and lift, and you should feel that transverse abdominis and everything else tighten up as well. So, yeah, so there's not a whole lot of movement through here. It should just be that pelvic floor kind of cinching together and lifting. Good. Okay. Feel that? Okay. And then yeah.
A little bit more. Just a couple things.
I'm getting them mixed up with the breath. So when we inhale, we're facilitating thoracic extension. When we exhale, we're facilitating thoracic flexion. Okay, so and then exhaling, it's going to help us flex the spine. You know, some of the stuff is in the ribs.
What else does this breath pattern help us do?
Oh, relax. So it helps decrease tension in the neck and shoulders, as well as just a relaxation. Okay. So now we'll go back on your back, and we'll work on the pelvic position. So the pelvic positions, we're going to be working in two positions, neutral and imprint. Okay. So neutral spine is our normal lordotic curve when we're standing. It's meant for the most shock absorption and effective movement. So this is where we want to work when we're in closed change exercising, meaning your feet are usually in contact with a stable surface, usually. To find that position, I want you to find your ASIs, your hip bones here, and your pubic bone, and just form a triangle. Okay. So now go ahead and rock back and forth. Yep, and that would be and forward. We'll do that a couple times, and then you're gonna stop in the middle, where those 3 points are level with the floor.
Okay, I feel like it's
Yeah.
there.
Does that feel like okay? Maybe point.
A little
Pelvic,
bit
yeah,
more.
right there. Good. So that's going to be our neutral. Okay. And then in order to find imprint, we are going to just slightly bring our rib cage down to our hip bone. So we're going to use our oblique muscles and get it. Yes, perfect. Good. And so we don't want to use our glutes. We want to make sure it's just the obliques bringing us into that position. Good. So with the imprinted spine, we're going to be working this one with open kinetic chain exercises, mainly when the feet are in the straps or when they're unsupported in, say, tabletop position.
What's that position called?
Imprint. Which? Oh, tabletop.
Why would we use imprint then?
Because it's a closed or open kinetic chain. And then rib cage placement. Am I good?
Yeah.
Okay. Okay. So then we're going to talk about the rib cage placement. The rib cage is going to be important for stabilizing the spine and keeping that in a neutral position. So with the rib cage, we're going to have a lot of movement with inhalation and exhalation. So in order to stabilize that, we use the abdominal muscles to kind of draw it down. So all the abdominals are connected to the bottom of the rib cage, so they're helping to stabilize that rib cage down. So perfect. You just went from kind of that pop down rib position to bringing it down into a more stable position. So we should feel those ribs kind of heavy on the mat. And again, with inhalation, we're going to have a little bit of spinal flexion. Inhalation, spinal extension. With exhalation, we're going to have some spinal flexion. So to practice that and see what those ribs do, I want you to just go ahead and lift your arms up overhead. Good. Get some rib pop in there. Good. So now come on back down, and we're gonna prevent that from happening. So I want you to inhale and reach up towards the ceiling. Good. Exhale, lift overhead, engaging those obliques to prevent those ribs from popping up. Much better. Inhale up to the ceiling, and then exhale down. Good.
Breathe.
All right. Perfect. That looked good. Okay. And then let's talk about our shoulder position. So the shoulder has lots of different movements. So one reason for this is because it lacks bony attachment to the axial skeleton. So it relies a lot on muscular attachments and stability of those muscles. So first movement, I want you to reach up towards the ceiling again. Good. And then reach up like you're kind of punching up towards the ceiling. Perfect. That's protraction, and then come on back down to neutral. Good. Inhale, reach up. Exhale, come back to neutral. Good. So that's protraction. Then we're going to go the other way. So you're going to go more towards the shoulder blades coming together. Good. And then back to neutral. Good. Squeeze them together. Back to neutral. Good. And go ahead and bring your arms down by your side again. Down by your side. And then we'll do elevation and depression. So go ahead and bring your shoulders up towards your ears, like you're shrugging. I'm sorry. Shoulders. Yep. There we go. So that's elevation of the shoulders and shoulder blades, and then go ahead and bring them all the way down. Good. So that's depression. Elevation, depression. Good. And then we're going to talk about upward rotation and downward rotation. So what I want you to do is lift, so keep one arm down by your side, and you're going to lift the other arm up overhead. Good, and then switch. So as that one comes down, bring the other one up. Good, inhale, bring them down. Exhale, lift up. So that's upward and downward rotation of the scapula. Okay. We want to initiate this movement during before every exercise, and okay. So the importance of it. Is it a movement?
How should they be?
Oh, flat on the ribcage. So they should always be flat, and you should feel them kind of gliding along the ribcage. All right, and then cervical position. So the cervical position is essentially going to follow the thoracic position when we're flexing or extending or side bending, laterally side flexing the thoracic spine. The cervical spine is going to follow. And the movement that's going to initiate that flexion is craniovertebral flexion. So with that, we want to do a head nod. So just bring your gaze towards your knees without lifting your head. We're just going to do a little nod. Yep. And then back to neutral.
This is not very flattering. The double
And
chin
then
look
just
is not good.
Gaze down towards your knees. Good. And you can do even just half of that motion too. So, yeah, right there, good. Good. And then let's try flexing up. So what we're gonna do is inhale, prepare. So don't extend your head back. Good, inhale, prepare. And then exhale, initiate that craniovertebral flexion as you lift your head, neck, and shoulders. And you wanna think about a small peach underneath your neck. You don't wanna squish it, but you don't want it to roll away. Good, and then inhale, roll back down. Head will be the last one to land. Good. And then we're gonna do cervical extension. And now you roll onto this, so your kind of abdominal area, belly button is gonna be on the ground. Good. So go ahead and bring your head down. Good, in flex position. And then you are going to exhale, lift your head and shoulders kind of pressing up. Good, so the thoracic spine should come with your cervical spine, so make sure you're not extending too much through the cervical spine. Good. Inhale back down. Exhale, lift the chest and head. Good, long line coming from the top of your head, keeping that spine nice and long. Good, exhale one more time. Good. Another cervical position. Head props, like you would use a head, yeah, you would use a pad underneath the head to avoid excessive craniovertebral extension. The head should sit centrally in between your shoulders.
Keep your hand on your shoulders.
I keep it right there. Okay.
All right, move on to the reformer.
All right, so let's go ahead. I probably don't need this all. Okay, so to get on the reformer safely, I want you to sit on this side here, but before we get on, let's just make sure this is actually set up for you. How tall are you? 5'6". Okay, so you would probably be on the second position here. Stoppers are gonna be flat. Perfect. So she's 2 and 2. And then we would just check to make sure that the D-rings are. Okay, so it is all set up for her. So let's go ahead and lie on your back on the reformer. So sit on the edge. Place your left hand on the shoulder rest and just kind of roll back. Yeah, good. I'm gonna start. Yeah.
Oh, no, I thought you said Casey.
I did, but
I said, can you see?
I'm talking about like Casey.
You did.
Okay, so we're gonna start with footwork just to kind of warm me up. So with you being internally, medially rotated, we're gonna start, heels together, toes apart. And so the balls of the feet go right on the foot bar, heels together, keeping them firmly pressed together. Go ahead and press out. So we're starting with 3 springs here. And inhale, come in. Good. So we're just extending those knees all the way, keeping that spine in a nice neutral position. Good. So we would do 10 reps of this. So let's add some pulses to this. So we just come halfway down, back up. All the way up, halfway down. All the way up, halfway down. All the way up. Good. And then bring it all the way back in. Good. Let's go to single foot. So you're gonna do the balls of the wrist. We're gonna do développé. So you're gonna get the ball of your foot. Quick question: do you want me doing both, like on a single one like this, both sides, or for
No,
time's
just-
sake,
we don't
just
have
do
time,
it?
just
Okay,
one time
yeah,
is fine.
that's what I thought. Okay.
She'll walk out a little funny, but.
So we're gonna get the ball of your foot here, and you're gonna extend your right leg over the foot bar.
Sorry, Casey, just one thing.
Yeah.
Just because, well, we can see, just make sure that we're saying the spring tension, what's on there.
Okay, yeah, I said on the last one. 3.
Yeah, I heard the last one,
Okay.
just make sure that,
Okay.
yeah,
Yep.
thank
And then
you.
this one's gonna be 2, 2 red springs. Okay, so what we're gonna do, a little bit of choreographing with this. So you're going to press out, you're bringing that knee into tabletop and then extending it up. Good. You're going to lower the foot, tapping the foot bar. Go ahead and lower the leg, back up. Lower the heel, dorsiflex, point, and then bend and extend back in. Good. So we're going to exhale, bend and extend out, lower and lift, flex and point both feet, bend and extend in. Good. So it's an exhale out, inhale, lower and lift, exhale, flex and point, inhale, bend and extend in. Good.
Just to be clear, what's the breath pattern?
Inhale out. Inhale, bend and extend out.
And then,
Exhale,
just,
lower and lift.
actually, just, you don't have to do it one more time, Marnie, just tell me what's the.
Okay, so inhale, bend and extend out. Exhale, lower, lift. Inhale, flex and point. Exhale, lower, or bend and extend in.
Good, thank you.
Okay, let's go to our straps here. So we're gonna go ahead and put our feet in the straps. Good. So let's go laterally rotate. You're gonna do heels together, toes apart, and you're gonna be in your low diagonal. Perfect. So with this, we're gonna work in and out of neutral and imprinted spine. Okay. So what I want you to do in this position so we're gonna inhale, hinge up, go to your neutral spine. You're gonna exhale, press away, pressing into imprint. Good, so hinging up into your neutral spine, pressing away to imprint and press away. Good. Good, keeping those like laterally rotated. Neutral, good. So that's on 2, spring tension. That would be 2 to 3. Okay, good. Now, let's do, while we're here, short spine. Okay, so what we're gonna do is start in our low diagonal again. So you're gonna start laterally rotated. Going laterally, yep, good. So you're gonna inhale, hinge as you rotate to parallel. Rotate to parallel. With your feet, good. Exhale, roll up. Good. And bend your knees towards your face, making a diamond. Good. Roll down. Keeping your legs laterally rotated 1 segment at a time. And then pull your feet to your seat. And then pressing out. Good. So inhale, in.
There's one thing that's missing about the starting position.
So your exhale,
One thing that's missing in the starting position that might be a problem for her.
Oh, sure, that's it.
Thank you.
Okay, inhale, hinge. Rotating to parallel. Exhale, rolling up 1 segment at a time. Good. Bending, inhale, bend your knees. Forming a diamond. Exhale, roll down 1 segment at a time. Inhale, pull your feet to your seat as you come down, and then pressing away. Whoop. Uh-oh. Gotcha.
Yeah.
Good.
Can we just do one more?
One more. Okay.
Thank you.
Yep. Just go ahead and inhale, hinge as you rotate to parallel. Exhale all the way up. Good. Bend your knees, bring them into a diamond. Inhale, exhale, roll all the way down. Good. Pull your feet to your seat and pressing away as you exhale. Good. Okay. Good. Let's do, while we're in the straps, we're gonna do, no, let's come out of the straps. And hold those straps in your arms. Good. So work on some scapular stability here. So we're gonna do so mid-back series at 2 springs. So I want you to start in a tabletop position. So inhale, bring your legs up. Exhale, bring the other leg up. Good. So you should be in an imprinted spine here. Good. And then I want you to pull straight down towards your hips. You're gonna, good. And then inhale, return. Exhale, pulling down towards your hips. Exhale, return. Good. Do 5 to 10 reps of this. Go ahead and come out as you come back up. We're gonna go out to a 45-degree angle or a Y. And same thing, really pressing down towards your hips and back up. Pressing down like your old wine bottle opener. And inhale back up. Good. Okay.
What's the starting position for these two?
So she's in a tabletop position, imprinted spine. Head rest, good, maybe at 1. And then arms straight up overhead.
Yeah, no. Where are the arms when we start on mid-back series for these two that you're choosing?
The straight down ones. At your
Yeah,
flex.
yeah, exactly. The arms start down in this one.
Okay.
Yeah.
Oh, that
So
was
for
just
both.
tricep. Okay.
Yeah, thank you.
Okay. I can count everything, so I don't know.
It's okay. We can move
Okay.
on.
Let's do. Okay, you can go ahead and find your foot bar with your feet. And you can put the straps back. Okay, let's go ahead and roll off the reformer. Okay, and we are going to do sidearm sitting press. So we're going to do one spring for this probably, maybe even a half. We'll see how the tension is. So I want you to face the window or the mirror, and you can sit cross-legged or whatever's comfortable for you. So we're going to do. Is that more comfortable than cross-legged?
Is it okay if I sit like this, or do I have to sit cross? Am I?
Are you uncomfortable in cross-legged?
No, but.
Let's say cross-legged.
Okay, I'm sorry.
No, it's okay.
Most
I was
people
like,
don't
wait,
choose
do I have
the
this sitting
mermaid,
on
but
or-
okay.
I just okay.
Okay. So what we're gonna do is, so you're gonna hold it in the far away hand, and you're gonna keep your elbow at your side, and you're gonna pull out. So you're gonna kind of externally rotate. Is that tension a little too much?
Actually, it's okay.
Okay, we can go down a little bit if we need it. Okay,
It's okay.
this one's a tough one.
Does it look like I'm struggling?
Well, maybe a little
Okay.
bit. We're gonna go just a
Okay.
tad. Let's try that one. Good. Perfect. Good. So you really feel that the collarbones open up as we rotate out, keeping that spine nice and long. Good. And then it's an exhale, pulling out. Okay. So next we're doing chest expansion to open up the chest and stretch the pecs. So we're doing 1.5 springs on this. So you're kneeling, facing the tower with the thighs against the shoulder rest. Excuse me. You're gonna exhale, press back, hold there, inhale, rotate your head to one side and then the other. Good, exhale, return. Again, exhale, inhale, rotate. Good, inhale, exhale, return.
My neck is crunchy.
Yeah.
Yeah.
Okay,
Wow.
so feel let's get a little bit more into, yeah, go into a little bit more lumbar flexion there.
Okay.
Yeah. Good. Feel the shoulder clavicles widen. Good. Okay.
You don't have to do it again, just the breath pattern.
Yep, so it's an exhale out. She's inhaling as she rotates, and then exhale to return.
Missing one breath there.
Inhale, repair.
No, it's at the end. So.
Exhale, inhale. Exhale. Oh, exhale to return to the center.
Mm-hmm.
And then inhale, return the
Correct.
arms. I missed that one. Okay, and then one more. And then go ahead and put those away. We're gonna do some side splits. Carriage down. All the way. And a platform extender. Okay, we're gonna do. I'll try 2 springs for you. Okay, so go ahead and stand on this stable part first, and then go ahead and put that. So you should be hips distance apart. You should be in a neutral spine. Good. If you need a sticky pad, just let me know. You can put that underneath your feet. Okay. So what we're gonna do with this one is the carriage leg is gonna do the pressing. Okay, so put most of your weight on the platform leg. Okay, so the knees, yep, are slightly bent. Good. So carriage leg is doing all the pressing out.
Oh, I can't do
Okay.
two, sorry.
Go ahead and
One and
step
a
on
half.
down,
Okay.
stepping with the
Oh,
out
that's
one
right.
first.
One.
Perfect.
Okay.
1.5 there, okay, and then I'll slide up first.
Okay.
Okay, so or weight mostly on hip, neutral spine, nice and tall, good. Carriage leg is doing all the pressing out.
Why do
Good,
I
so
stay-
this leg should stay nice and stable there. How's that resistance?
It's hard.
Hard, yeah, we can yours a little bit more.
Yeah, it's hard. Harder than I thought.
It's 1 to 2, correct? 1 to 2 sprints
Yeah,
normally, but
yeah.
yeah, it's a hard, yeah, I know,
Yeah.
it's a hard exercise. You want to start one?
Yeah.
Okay. So you can have this, right?
Gosh, I
Oh
don't
my
remember
God.
it being that hard. Yeah, this is much better.
Okay, good.
Oh my gosh, I'm
Stabilizing through
I'm
the
sore.
platform leg. Good, pressing out. Good. Good.
Oh my gosh.
Good. So it's an exhale, pressing out, inhale, returning.
Whoops.
Keeping up that. You can even stand up a little bit taller than you were, just slightly back. Yeah, good. Keeping that spine a little bit more into close to your tilt. Just get yourself back into a neutral position. That looks better. Good. Okay, now we're gonna press with the platform leg. So now most of the weight is on your carriage foot, pressing with the platform leg. Same thing, nice and still through the hips and core. Good. Same thing, exhale, pressing out, inhale, and returning. Good. Good. And you can step back onto the platform and step down.
Thank you.
Okay. Good. Good choice. Let's show me. Round back knee stretches.
Okay. So, we'll go back up to 4. Knee stretches should be 1 to 2. Let's try with 1.5. Okay, yep, kneeling on the carriage facing the foot bar. Okay, so you're going to start with a round back, so we're going to have a C curve, good. Keeping that, you're almost kind of looking down at your knees, good. Like you have a beach ball underneath you. And keeping basically from your hips to your head, nice and stable, that doesn't want to move. You're going to press the carriage back. Good. So inhale, press back. Exhale, quickly return. Coming all the way to the stopper. Good. Round a little bit more at your back. Good. Keeping those hips nice and stable. Round through your lumbar spine. There you go. Much better. Keep that rounded pelvis. Inhale out. Exhale in. Try not to move through here. A little bit more lumbar flexion. Good. Okay. And coming on in.
Perfect. Show me coordination.
Okay. Coordination, you're gonna be on your back. We can put this up 1. You're gonna be in kind of the dead bug position, so tabletop with the legs. In the tabletop, you're gonna start with the elbows bent, head laterally flexed, head and neck flexed, so you're gonna come up into, yep, kind of like a dead bug. Good. So you're gonna inhale out to your 100th position, so straighten your legs and arms. Exhale, open your feet, bring your feet together, bend your knees, and then bend your elbows, keeping your, staying flexed. Good. So it's extending out, arms and legs out. Feet the legs open and closed. Bend the knees first, and then bend your elbows. Good. That's it. Inhale out. Exhale, inhale. Inhale, bend, exhale. Okay, so the
One more
inhale
time.
out. Beat the feet. Exhale.
Okay. Marty, you can come out of it now.
Sorry.
Yeah, just tell me the breath
Okay.
pattern.
So it's you're inhaling, straighten the arms and legs.
Mm-hmm.
Same breath, you're abducting and adducting.
On,
The exhale.
uh-huh.
Inhale, bend your knees. Exhale, bend your elbows.
Perfect. Okay. That's a wrap.